thing and made it work. So we're on, and I want to apologize to you for a late start, but today is going to be a very special day because I'm going to share some. We're going to have a little chat about cancer. Actually, we talked about cancer all year long, pretty much, and I made a decision since early in the year that we're going to spend lots of time discussing it because of the concerns that I have for cancer and what is happening in our society, because it's not there's no target person anymore. There's no target race anymore. There's no age. You know, cancer. It's affecting everyone now. You know, anyone can get it, and like I've always said, and that is known, that we all are born with cancer cells, and we just need to know what not to do to activate those cells. You know, it's almost like you have coals burning and the smoke is coming out the coals, you know, and it's happening all the time. The coal is the smoke is coming out the coal, and then someone decides to get a piece of cardboard and fan it, you know, and give it some oxygen. That's what you're doing. Give it oxygen, and then the fire starts to burn, right? When you feed yourself with the wrong things, when you expose yourself to the wrong chemicals and foods and environmental toxins, you know, even toxins that are used in the food that they prepare, you know, then those are the type of things that can activate those cells, like fanning the fire. And then depending on your system, your immune system, how bad it is or how good it is will determine if the fire is going to go out or if the fire is going to just take off, you know. That is kind of what happens when you do the wrong things with cancer cells. And I can tell you folks, cancer doesn't have any race anymore. There's no racism with cancer. There's no religion with cancer. There's no ethnicity with cancer. You know, it affects all races, all ethnicity, all religions. So don't think because you might be one type of religious person or another. At one time, the cancer rate was very low in the Adventist circles. It was very low in the Seventh-day Adventist circles, but there may still be some fact to that, but it's not as good as it used to be years gone by. You know, because of the diet that the Adventist persons who practiced healthy eating habits had, the cancer rate in that particular religion was lower than the average in the other religions, you know. But that has changed quite a bit because now Adventists eat all sorts of things, and they're not really following the lifestyles and the religious, the dietary practices that made the church or the religion so famous in the past, right? There are lots of myths about cancer and what can happen, but you know, I think the technology is available now where we could really dig in and get information, access information that is more sound and solid when it comes to you know what cancer really is, you know. But the question I have for you today, most of you, is, do you really know what is cancer? You know, do you really understand this illness, this disgusting disease that is named cancer? Do you really know what it is? You know, do you really know how it works, how it takes an effect on your body? Do you really know where it starts and how it starts? You know, Those are questions that many persons are not able to answer. They're lost in the sea, trying to understand really what causes cancer. But this is Breast Cancer Awareness Month, as is known. Um, I say breast cancer awareness needs to happen all the time, not just in November or September or October or any month. Cancer of the breast doesn't mean cancer only in the breast. And I'm saying this without any hesitation. Okay, for all of you who listen out there, I don't care who you are. Cancer in the breast is not only cancer or cancer only in the breast. I mean, you're humans and you understand. I don't think I'm speaking to robots. If I am, robots will understand probably more in many cases. Your breast, and by the way, breast cancer does not only afflict women. So I want you to get that in your head. Breast cancer also afflicts men. Yes, breast cancer has its roots also in men. So it's not just a woman thing. So when you carry this pink bow, pink represents a woman, you need to change that. Because pink in our society, as we know, represents woman. And the reason why they have a pink bow is to indicate that Breast Cancer Awareness Month is actually, for the woman to say, okay, this is our Breast Cancer Awareness Month. Well, nonsense. Breast cancer affects men too. So what color is the man? What's the symbol of the color for the man? I guess it's blue, right? So you're going to have to get a red, a blue bow and a pink one. That go, maybe the blue one will be a little less dominant than the pink one because it affects more women than it affects men. But breast cancer, and I'll prove that to any one of you, breast cancer is also affecting men. That's the first myth that needs to be raised. Secondly, breast cancer is not only cancer in the breast. It is probably local to the breast, but common sense will tell you that breast is also part of your body. Okay? And even though the cancer may be local to the breast, or it is more dominant in the breast, those cells, my friends, are elsewhere in your body. Okay? So you want to get that in your head. What is happening is that because of the way the breast is structured, it is more prevalent or prominent in that area because of the fatty content of the breast. Okay, all of the sections of the breast, most of it is of a fat nature, and there is more likelihood that the cells will attach themselves in that area. Okay, this brings me to another subject, another situation where we must understand that the more fattier you are, if I can use that word, the more fat you possess in your body, the more chances exist that you are a candidate for cancer. Okay? The more fat you have in your body, the more chances are that you are going to be a candidate for cancer. So you want to kind of get rid of as much fat as you can. Seriously. Okay? The other thing about fat is that the more fat you have, the more chances exist for you to become diabetic and or hypertensive. You see? Because you're putting a lot of strain on your body system, on your pancreas, on your gallbladder, and the other thing that, as I talk, I'm thinking, many of you would have had your gallbladder removed. Well, you probably did it because you were told that a gallbladder was a problem. It had a big stone, and you can't remove the stone unless you move the gallbladder. Well, those days are long gone. You can get rid of stones without getting rid of a gallbladder. All right. So I think one thing that we need to understand is that medicine has gone by leaps and bounds into a direction that many physicians are not familiar with. I'm saying it openly. I don't have a problem. Many of the physicians are not au fait with where medicine is today because they've been trained, they practice, and that's it. They don't keep up with the technology. They don't keep up with the times, with what is happening. They don't read anymore hardly. They don't get involved in research. Most of them, I can say most of them, they just practice and they practice. And medicine has grown and have changed by leaps and bounds, and they're left behind. You know, so we need to also realize that there are more different approaches to dealing with cancer now than there were years ago. And I can tell you all of this because many of you don't know that I am a survivor of cancer. I'm saying it openly today. Many of you do not know that I am a survivor of cancer. And I never used the methods that were prescribed for me to use. No, because I did my research, I did my way back in the past. This happened a long time ago. And that is what propelled me to be where I am and to do what I do. Because the physician who was looking at me, who's a very good friend of mine today, Dr. William Abernathy in Alabama, Dr. Abernathy said to me, he says, Joel, you know what? Because of the fact that I know what I know, I'm saying to you, go, study, learn, do everything you can to master what you did and teach it to people. He said that to me long time ago. You know, and he knew why he said it, because what he said back then is still happening today. The real true answer to cancer is not what people use. It's not the methods that are taught. The real true answer to cancer, first of all, is prevention. First of all, it's prevention. You do what is necessary to try to prevent yourself from having those cells activated. You position yourself properly in the environment as much as you can. You detoxify your body, remove all those chemicals and toxins that you breathe, that you eat, that you smoke, that you drink on a daily basis. You know, you detoxify, you deworm. One of the biggest, most contributory factors to cancer, my friends, is worms, parasites. Worms that we believe as adults we don't have. We think worms is just for children. Well, I have news for you. Many of you sitting watching me right now are laden with worms, and you don't even know it. Many of you. One of the biggest, most contributory factors to cancer is worms. So when we talk about Cancer Awareness Month or Breast Cancer Awareness Month, there's several factors that need to be looked at that may have contributed to that breast cancer, including and not limited to STDs. Yes, sexually transmitted diseases. We're talking about conditions or viruses or parasites or bacteria or toxins that activate the cancer cells. Cancer is not a standalone disease, and I would argue that, or discuss it, not argue, with any physician. Cancer is not a standalone disease. It doesn't come by itself. It doesn't happen on its own. Get that in your heads. Don't let nobody fool you, folks. You've been fooled a lot about all sorts of things. But get down into learning about your bodies and how it works and what is in your best interest of trying to understand what you do, what you eat, what you drink, what you avoid that can activate those cells. You know, toxicity is another factor that creates the environment for cells to be activated. Toxicity. Don't be fooled by all the garbage and all the medical terminologies. Yes, there are lots of people out there who pretend to know what cancer is about. I'm saying it to you openly. But cancer is not standalone. It's not by itself. And it has no bare roots in any one thing. Certain types of cancers, yes. Yes, there are some things that can trigger off the activity of the cells and can lead to certain types of cancers. But for the most part, there's several factors, several things. Today's water. Today this is water and a hint of pineapple. You know, so when we talk about Breast Cancer Awareness Month, listen, it needs to be, in my opinion, Cancer Awareness Month. Because if it affects the breast, it's affecting your body. This is the reason why, my friends, there's some people who have breast cancer, as they say, as is known. They go and the therapy is administered, whatever it is, if it's radiation or chemotherapy or whatever. Or if the breast is removed, resection or taken off. This is the reason why within a little bit of time, the cancer goes to the other one. Yes, how did it get there? If you take the breast off, use your common sense. If you say this cancer is in my one breast, in my left breast, for instance, and you do everything you can, and you says, you know what, to really help you to overcome this cancer, we have to take the breast off. You take the breast off. Next thing you know, 6 months to a year later, maybe a little longer, the other one, right side one, afflicted with the cancer. Now you got the right breast cancer, and you're going to take off both. There's a movie star who took off both of the cancers because her family ended up with breast cancer. She removed both of the breasts. You think she can avoid herself from getting cancer? Heck no. It doesn't work like that. She might as well have saved her breast, so now I'll be able to have some activity there that could make a difference in a lot of ways happening to that breast. Because she did the wrong thing. In my opinion, she did the wrong thing. She could still have cancer and die from cancer. She could have cervical cancer. The cancer in your breast is also cancer in your reproductive organs, because your breast is a part of your reproductive system. If you don't know, check it. Yes, if that cancer is in your breast, chances are it could be anywhere in your reproductive system, because the cells had to have gotten activated and ended up there, not stand alone. You see? So we have to understand lots of things about cancer to get to a point where we really feel comfortable about knowing what to do to protect ourselves from the scourge. You notice we're having a lot of deaths from cancer now, a lot of cervical cancer, ovarian cancer, uterine cancer. There's a reason for all of that. There's a reason. And no one is exempted unless you practice those or you exercise the practices that are necessary, which are a lot. And in an environment that we live in today, my friends, listen, it is not easy. You got to be detoxifying quite often to avoid yourself from becoming a victim. When I say detoxifying, I mean putting your foot in no bathtub where you soak your foot and somebody say all these things come. No. That's a hoax. I ain't talking about that. I'm talking about the same things that you do in your mouth to provide much of what you provided to activate those cells. You take the detoxifying composition in your mouth and allow it to go through the system and purge and remove cells and unwanted toxic matter from your bodies. Don't let nobody give you any nonsense about putting your foot in a thing and then I plan to buy one and demonstrate how big of a hoax it is. I plan to do it. I'll bring it right here and show you that I'm going to put a matchstick inside that water and the color will change and become just as brown and dark as they do when they say your foot inside. I'm going to buy one and bring it here. I had one and I sold it to someone. I sold it to someone who felt that they're going to do nails and so, but I hope they're not doing that. They're not conning people, because that's a big con. That's a hoax, right? Folks, listen, seriously. We've got to make a decision if we want to live healthy lives to, number one, do something about our environment. We have a lot of pollutant factors in our environment now. Seriously. Okay? Number two, we've got to do something about the produce in our country today. We have more farmers producing more foods with more chemicals today than ever. And no one is doing anything about it. No one. And that is where a big factor is that contributes to the toxic matter that we consume. Because even if we wash and we try to do everything that we can to prevent the chemicals from entering our bodies, the chemicals are in the produce because they spray it and it absorbs into the system of the plant. Yes. So we're in jeopardy. I keep saying it. We need to get back to organic farming. Or we need other people to start farming by organic means. Or we all are going to have cancer in this society. Because the chemical toxins, and I'm telling you, I see it on a daily basis. Daily I see it. The level of toxicity in people, it's alarming when I show them, and they can't believe it. We screen them and we find it and we show them. It's crazy what's happening out there. You know, the other thing is that many persons are walking around with sexually transmitted diseases and don't know it. Many persons. Lots of people. You have to learn and understand that those conditions contribute to lots of things. Yes. I'm talking about people who walk around looking healthy, feeling healthy. You know, they're not having any symptoms, but yet still something is wrong, and they know something is wrong, but they're not feeling anything that is indicating to them that they have an STD. And it's not detected because there are no symptoms. Bingo, I'm okay, everything is okay. Yes. Soon enough, at some point, the woman starts having some pains in her lower abdominal region. She has started having some problems with her period, painful period, clots. She started having some discharges, some that she can't even stand, the smell of it. Listen, I'll say it again, I'll say it openly, I'll challenge any physician to prove me wrong. If a woman is having a discharge, except for menstruation, her ovulation, and her orgasm, she has a problem. And it needs to be investigated because that discharge is a factor in problems that you have that can lead to cancer. I say it openly. Challenge anyone. Prove it to me differently. You know, we've rescued an enormous amount of women already from the scourge. And I have a text I could show you. If I could have only shown you. Just today I received someone who was suffering with cancer. And yesterday, God did a miracle in her life, and today she's free of cancer. Yes, we treated her for a couple of years, I think. She's free. No radiation, no chemotherapy. She was very, just a couple of months ago, she was very disgusted with the process. She was frustrated and fed up, and she came and almost cussed me out too. Tell me how kind of thing. But I knew she had to go through a process, and I saw it. And I said to her in a nice way, you know what? Just be a little more patient. Just be a little more patient. You know? And today I got a text, so I wish I can show it to you. I got the text today from her. She was just by the clinic a couple of days ago. She's now happy because she doesn't have it anymore. Not that she can't get it back. You go back doing the same things you did before, it's going to recur, it's going to return, and it might come violently. Because when it comes back, it doesn't come back quite as it did. It comes back with vengeance. Because you should have learned from what you did and what you went through. You know? So don't think because it's gone, you can't get it back too. You will get it back if you do the wrong things. It will come back. Like H. pylori. You think when it's gone, it's gone? No, it will come back. You do the same things that cause it, it will come back. You see, so we have to understand that even though a physician may say to you, oh, your cancer is gone, you go back and do the wrong things, it will come back. And I can speak not only from my lips, or from my research, or from my studies, or from my work, I can speak to you from experience. Because I had it. And I vow never to get it back. You got to put it in me to give it back to me. I ain't getting it back. I say that because I know what I went through, and it wasn't easy. You know, I got to the point in my treatment of my own where I became skin and bone, my friends. I can tell you. Yes. Before I was able to recover, and I didn't use a single pill from the doctor. No radiation, no chemotherapy. I was determined not to go there because I see what happened to people. I read about it. I know. I lost a sister and a father to cancer. Yes. A sister, my eldest sister, I lost her to cancer before I had just gotten into my practice. In early 90s, I lost my sister, 93. And then my father, just years ago. Yes, so you can't tell me nothing about cancer that I don't know. And I keep learning every day. I had experience on my own. I lost a father, and if they had listened to me, I think my father would have been here still. But you know, it's America, and I'm in Guyana, and even though I go to America all the time, the doctors over there, they know everything, the Cancer Institute, this, that, the other. It didn't last very long. I even give them, and it's funny, in both of the cases of my father and my sister, I almost give them the exact time that they're going to die if they don't change what they're doing. Yes, my sister died one day after, and my father a few maybe hours. You see, there's some things that are, I can't really tell you. There's some things that are there, my friends, that once you go down that road, there's no turning back. Yes. Once you go down that road, there's no turning back. And many of you who would have lost siblings or lost fathers or daughters or sisters or children would know what I'm talking about. You see? It should be Cancer Prevention Month or Cancer Prevention Year. Not awareness. We are aware that cancer exists. What do we need to be aware of? Huh? We don't need to be aware of it. It exists. What do we do to prevent us from becoming a victim is what we need to know. Cancer Prevention Month or Cancer Prevention Year. Not cancer awareness. We know. I mean, if you don't aware of it, then you're not living it. You're not living in the world if you don't know that. I am, I guess, controversial, but that's okay. You know, we're all not going to be the same. And none of you are not going to believe me either. That's too bad. You know, many of you who didn't believe me are not here today. And some of you know that. You know, I speak the truth. I speak boldly, and I speak clear. It should be cancer prevention. We are aware that cancer exists. We don't need cancer awareness. We need cancer prevention. If I were a health minister, I'd change that. When it comes to cancer awareness everywhere else, in Guyana, it'll be Cancer Prevention Month. These are things that you need to know. These are things that you need to do. These are things that you need to abstain from. These are things that we need to follow. Prevention, always best. Beat me up. That's okay. I can take it. I used to box. I got thick skin. So, let me say this to you, and I say it clearly. If you don't want to become a victim of cancer, get serious about your health. Try to find ways and means of providing what you need to eat from your backyard, or from your tub, or from your tires, whatever it is. You plant in your yard, or plant in your house, or on your veranda. You can plant on your veranda, you know. Look, some of you got some huge verandas, and you got pets. Put some pots, put some tires, little tires, put some things on the veranda, and instead of growing wild plants, put some callaloo in there, put some bora, put some pak choy, put some bolange on your veranda, and plant foods and feed yourself naturally. That's one thing you can do. Stop eating the barbecue foods. You think you're not smoking? One leg, and listen to me clearly, one leg of smoked barbecue chicken is equivalent to smoking 300 cigarettes. That's not Dr. Haynes' research. That's written, but you have to look for it. You're not going to find it so easy. One leg of smoked barbecue chicken is equivalent to smoking 300 cigarettes. I can explain the TV to you and all that because I know. So those of you who don't smoke, you're smoking more than those who smoke because you're eating a lot of barbecue. Okay? So that is one that you need to think about. This is, and it's a serious factor. You know, we consume We consume what smells good. Oh man, look at this. Oh, look at it. When you look at barbecue flesh on the top of the grill, it makes you, when you smell it, it draws you to it. But what you don't understand is that when you consume it, the smoke, the amount of smoke in that flesh, you cannot count. You cannot count it. You can't even measure it hardly. Because the factor determined that one leg is equivalent to 300 cigarettes. We don't know how much longer that meat, that flesh would have been sitting on that grill. We're just talking about chicken. We're not talking about ribs, and we're not talking about pork chops and all those things that you put in the grill that will require more smoke to have it so that you can consume it. We haven't talked about that. We're talking about one leg of smoked barbecue chicken, and some of you eat more than one leg because one leg can't fill your big bellies. You see, so those are simple things that we overlook, my friends, that contribute to the activation of the cancer cells. Cancer is not by itself. You don't just wake up in the morning and say, oh, I have cancer. No, it's a process. It's a process. And when you activate that process, when you hit that switch, and that process begins, unless you realize that you've done that and change the course early, there's a point that when it gets there, there's nothing you can do. You've already destroyed all the cells, all your good cells. The cancer cells would have overpowered the good cells. And then when you talk about, oh, you know what? Oh man, you've got to get some chemotherapy. Yeah, okay. Chemotherapy does not recognize good cells. It doesn't. So the little bit of the good cells that you have remaining, the little amount of the good cells that you have remaining to work for you, my friends, when you take chemotherapy and radiation, it doesn't recognize those. It destroys everything. That's why you lose your hair and your color skin changes and all these things happen to you. Not because it's killing the cancer cells, it's killing all of your cells. And then we say, oh, within 10 days or so, you're going to rejuvenate new cells. Oh, right, okay. What's your immune system like? What is your immune system like? Is your immune system big enough or high enough or charged enough to remove the destruction that has occurred and to help to rejuvenate those new cells? Many of you don't come out of it, my friends. How many people don't you know that went through that just went on and just kept going and then they buried or they burnt? Cancer Awareness Month? No. Cancer needs to become a lifestyle. It needs to have lifestyle changes. Cancer needs to become something that says cancer awareness. Period. And then cancer prevention. Cancer awareness meaning we want to make you aware, like I'm doing, of the things that contribute to your cancer. And then, when it comes to Cancer Awareness Month, forget about that. Cancer Prevention Month. Cancer prevention years. We are aware of cancer. So what in the world you come to me with cancer awareness? That's the people who don't know and who can't understand English. Because we know it's here. We know it's around. We are aware of it. What are you making me aware of now? Cancer? No. I want to know what I need to do. I'm talking like my African friends. I want to know what I need to do now to prevent myself from having the cancer. Because I'm aware of it. Beat me up. That's okay. I can take it. I got thick skin. Anyway, I just look at the clock. I got 19 minutes left. And my good brother just walked in. How you doing, brother? Peace be unto you. They keep calling me you and you me? Calling you me? Well, look at that. Well, I'm in good company. Listen, I know you got some questions, and I'll try my best to answer. So I'm going to ask my operator to put the number on the screen, and she did. Oh my goodness, she has a video she wants to show. All right? I'm going to ask her to show the video, and then when they come back in, I'll take your call. So you stay tuned.
Pat, once again, scientists are discovering the health benefits of Bible practices. We've already told you doctors say forgiveness, resting, and letting go of worry are good for your body. Now you can add fasting to the list. Lori Johnson explains.
It appears fasting dramatically strengthens our immune system. Researchers at the University of Southern California studied humans and mice who went without food for 2 to 4 days at a time for 6 months. The fasting triggered their bodies to get rid of old, inefficient cells and regenerate new, healthy ones.
This means fasting could be a key to aging well, because as we get older, our immune system weakens, making us more vulnerable to disease. Fasting could prove especially beneficial to people going through chemotherapy or who suffer from autoimmune disorders.
Fasting reduces the enzyme pKa, clearing the way for stem cells to renew, and lowers levels of the IGF-1 growth hormone, which is linked to cancer. One of the study authors compared it to lightening a plane of excess baggage, saying when you starve, the system tries to save energy. And one of the things it can do to save energy is to recycle a lot of the immune cells that are not needed, especially those that may be damaged. So what's good for our spiritual health also appears to be good for our physical health. Lori Johnson, CBN News.
And Pat, once again, the Bible has the answer.
It's got the answer. Our good friend Chauncey Crandall has come out. He's a noted cardiologist, and he's been advocating fasting. A couple of days fasting makes a huge difference. A huge difference.
Amen. Easier said than done, but it's
easier
wonderful
said.
when you can actually do it.
That's
You
right.
feel so good. Yeah.
That was nice and short and sweet. And we're talking about fasting. Oh, fasting can save your life. Fasting can change what happened to you in cancer. But the phone has been ringing, and I didn't answer it because we had the program there. Sure. But you can call. You call. I'll do my best to answer in whatever way I can, so that I can help you to maybe figure something out. Good evening.
Hi, good evening, Doc. How you doing?
Fine, thank you. And how are you?
I'm okay. I'm studying. When you say don't eat, so chicken is not good for you and fish is not good for you. So if you tell me it's not good, I won't eat it. I don't really eat it too much, right? But I don't eat fried food.
Here what is wrong with the fish and the chicken, and I'm saying this without any reservation.
Mm-hmm.
The fish used to be okay.
Mm-hmm.
The fish is now contaminated with mercury and all sorts of chemicals from the water.
Mm-hmm.
The fish also comes with worms and larvae.
Yeah, but I don't eat pork. I don't really eat chicken. One or two times I'll bake a chicken. you
Listen,
know?
as long as you're eating flesh, you're going to have a problem.
Okay.
They're going to come with, listen, the other thing is, they come with their own chemicals.
It's true.
And you absorb into your body what you consume.
It's true, though. Anyhow, I make appointments for next week Friday to come and see you. So when I come, I usually...
We're going to spend some more time talking about things, okay?
Yeah. Thank you, Doc.
Thank you, my dear. We have to understand that. That's the other thing. You know, when we believe that when we eat something, you know, when we go to the toilet and pass it out, it's done. We absorb what we consume. Good evening.
Good evening.
Good evening to you.
I had an accident and I damaged my fourth or fifth vertebra.
The volume on the television is a little high, okay? You could turn it down a little bit. But go ahead quickly.
Yeah,
You're still high a little bit. I'm hearing the echo. Go ahead.
yes, and I had, and this was 2 years ago, and I had an
MRIs?
session, and I'm able to walk now. I start walking
Okay.
when they said I would not have been able to do that. But what is happening to me now is that I'm getting numbness all
Yeah.
over my body.
Yeah.
Numbness and when I sleep at night, I turn on the right, the whole right goes numb, and then I turn on the left, and the whole left goes numb.
Well, there are two factors or several factors, including two main ones that contribute to that. Number one, you may have had some nerve damage. A nerve actually transmits the signals. okay, from your brain,
Yeah.
right? So you may have had some nerve damage. And secondly, you may have some coagulation in your arteries,
Okay.
right? Because you were not active as much as you were, over a period of time. And you may have some coagulation in your arteries, which interferes with blood flow and oxygen,
Okay.
right? So what we need to do is probably screen you and see if there is coagulation. If there is, then we can help you to remove that. Or your body can, with the right application, you can remove the coagulation so you can get the good oxygen and blood flow to take it to the areas where you need it. Because listen to what you're saying. If you lay on one side, that side becomes numb, right?
Yes, yes.
But if you stand, if you get up and stand up, you feel it feels better.
When I get up and stand up, the numbness goes away, but not total numbness.
Exactly. So we have a factor of coagulation most likely occurring, and then we also have a factor of maybe some nerve damage. There, you can be helped, okay?
Okay.
You can be helped. You just need to probably get to us. We have the bed there that can do the therapy, number one.
Yeah.
Number two, we can screen you. We have the device that can screen you and to see exactly if you have coagulation and where the coagulation is occurring.
Okay, okay.
All right? So there is help. How old are you now?
Yeah.
How old are you?
I am 65
Okay. Well,
next year.
You still got some life in you. So, get the help and get yourself back. And I don't think there's any. You sound as though there is no permanent damage there. So, there's hope. Okay.
Yeah, I've been using this Bico tablet and
Bico is not going to fix that, my friend.
folic acid. That's what they've been giving me at the
No.
medical center.
That's not going to fix that. No, you got to go beyond that. Okay.
Okay then.
All right. Thanks for calling.
Bye bye.
Bye-bye. Everything is Bico. Bico. Good evening.
Good evening, Doc.
Good evening to you, my dear.
Good night.
How are you?
Well, I'm not so nice.
What happened to you, man?
Hemorrhoids.
Hemorrhoids.
A cream. I push up something. You understand what I mean there?
Yeah, it's suppository, yeah.
Yes. But I forget what you call it.
Maybe preparation H or something like that?
Huh?
Either preparation H or Anusol, one of those?
It's preparation made. And I'm
Okay.
using that. And I read in an old newspaper they use coconut oil to rub the area with coconut oil.
Mm-hmm.
But when I stool, I pass, blood.
You know why? Because the hemorrhoid, every time you stool,
Yes.
if the stool is brittle and
Yes.
not soft, it will rupture it.
Very hard.
You see? So you're never going to get rid of the hemorrhoids until we change what's happening to your stool. There's always a reason. There's always a factor that contributes to something.
Okay.
So we've got to look at your diet, modify what you're doing. Maybe you need to consume more water, more fiber, or less fiber and more water, right? And more fruits, more vegetables, things like that. Come off the flesh.
Yeah.
I always say to people who have hemorrhoids, come off the flesh, number one. Come off the flour, number two.
I don't use hard no.
You hardly,
The flour, not too much of flour.
okay, you use biscuits?
Yeah.
You use biscuits.
Yeah.
And that's very dry. That's just as bad or worse. Okay?
Okay.
Come off the flour for a while. Okay? Come off the flesh for a while. Make sure you consume enough water. Use fiber, make some oats, get some fruits, make a fruit salad, vegetable salad, make that part of your daily routine every day. And then eventually it will heal and you won't have the bleeding.
Thank you so much
You're welcome, sweetheart.
for the rest of your night.
Okay.
For your program very much.
Thank you. Thank you for tuning in, okay?
Hi.
Good then. Bye-bye. There's also there's a process that you go through when you have hemorrhoids that helps with healing. But this one is a little painful, where it's like a sitz bath, we call it, where you put some warm water, some hot water, and you put maybe some peppermint oil or wintergreen oil inside. And you sit over that, not right on it, and allow the steam with the tincture inside to go up, and it will help to heal it too. Good evening. Good evening to you.
Hi, Joe.
Yes, my friend.
How are you doing?
Fine, thank you. How are you?
I used to come to your clinic in London.
In the early years in Alberton.
Yeah, I came down with Tom first, and then I used to come for treatment in London. I now have a stroke. My blood pressure, my diabetes messed me up. I'd like to make an appointment to come and see you.
All right. Write this number down, if you can write it down. And you call the office, okay?
Okay.
It's 231
221.
6477. Call it in the morning.
Oh, yeah, all right.
All right?
I will. I'm sorry you will.
Okay, my brother. You take care.
Okay, bro.
Good then. Bye-bye. Yeah, I remember. He sounds like somebody I can remember. It was a long time, though. Long time in Albertong. That's... You said donkey ears. Donkey ears. Oh, long like donkey ears. Donkey ears. Look at that. It's true. We said donkey ears, but it's donkey ears. Oh, long like donkey ears. Thank you. Good evening.
Good evening.
See, I just learned something. You know, we say does like donkey ears. It's not ears, it's donkey ears. How you doing?
I have a problem with some arthritis here.
Oh boy. Yeah, we have a problem with some pains. Don't say arthritis pains. You're having some pains. Okay? Sometimes we put the words on things that is not really what is happening to you. You're told that that might be it. And we associate that with it, but it might not be that. Where are you having the pains?
My knee mainly,
Your knees,
shoulders,
shoulders, your joints then.
yeah,
Okay, all right. What's your body size?
no.
You're small or big?
I'm small,
You're small. You're small in size?
yeah,
Okay, you see, it also means that arthritis or pains don't recognize body size anymore. Normally, it used to happen to people who are bigger,
yeah,
but it's happening to people who don't have any size now. What does it tell you? It tells you that there's something happening in your body system that is starving your joints. Your joints are not being given the nutrients that they need. Understand? How old are you now? What's your age?
I'm 61.
61. When you get to be 40, your body needs more minerals. Especially at 40. 40 and beyond. The older you become, the more minerals your body needs. Not calcium, minerals. So what is happening to you that's causing your pains are two things. Number one, you're having problems with your mineral count, it's low. Number two, there's three things, sorry, there are three things. Number two, your collagen or the cartilage between the joints appears to be worn or missing. Number three, your immune system obviously is not working properly. You need some help. Have you been getting any help?
Once, but I'm on pain tablets, and that's 24 hours, that's wear out, I'm in trouble.
You're taking pain tablets. Pain tablets would not fix that. If you want to correct it, then that's not the way to go.
Okay.
You have to identify where your deficiencies are, my friend, and address those deficiencies. Okay?
Okay.
Pain tablets, temporary. Okay?
Yeah. Okay, I'll call the office tomorrow.
You do that.
morning.
Do that. Because I don't know where else to send you, but at least if you come there and you follow the rules, I know you're going to get better. Okay?
So it could be repaired?
It depends. It can be repaired. At least it can be repaired so you can walk without pain. I'm certain. But we don't know how badly degenerated those joints are. We'll have to find out.
Okay.
So I ain't giving no guarantee. When you come, we're going to find out, and then I'm going to say to you, okay, here's what could have happened. All right?
Okay, love.
Okay, my dear. Take care.
Thank you.
Sure. Bye-bye.
Bye.
You know, something happens to people at times. And because you're so, you've had your pains for so long, when you get to the point where you can get the relief, you expect it overnight. It doesn't happen. I don't offer a quick fix. The only quick fix that I know is the maker who's responsible for us. That's the only one I know. Good evening.
Good evening, Dr. Hill.
Turn your volume of your television down. Yes, I'm running out of time. Be quick.
Good evening. I got a little problem. Not a medical problem, but a patient problem.
not only your program, but I live in Narconville, but Channel 2, and I right up to volume 50, and I could hardly hear.
Really?
Technicians could do something about it.
Oh my! All right, I know they're hearing you, so they're gonna look into it. Okay?
All right, thanks a lot.
Thank you for calling. All right, I know my operator would have heard that. The volume is not going out as it should, but I don't know if everyone has the same problem because no one has mentioned it. But I know Valen is pretty good. She look into it. Good evening.
Good evening,
Are you hearing clearly?
Dr. Haynes.
Are you hearing me clearly?
Yes, I'm hearing you clearly.
Okay, my dear. How can I help you?
Yes, I heard you just spoke about the minerals.
Yes.
I would like to know where you get minerals from, like what tablets or what liquid or what food.
All right. Minerals can be gotten in foods. The problem is, in today's foods, we're not getting the quality of the food that we used to get in yesterday's foods. So the amount of nutrients that we should have gotten, we don't get it anymore. So I suggest that you supplement with a good absorbable mineral complex. That's natural.
That could be.
Well, they have them in many places, but maybe not here. We have them at the clinic, I know, because I bring them in. I use it myself, and I bring it for persons who need it, come near. You can use what we call colloidal minerals.
So if I come there, I can have it.
Sure you can. Sure you can.
Tell me where it is.
It's in Kitty. 72 Queen Street, Kitty.
72?
72 Queen Street, Kitty.
Okay. I'll try to find this place.
We're right next to Kiskadee Daycare and obliquely across from Windjammer Hotel.
Good.
With those two landmarks, you're supposed to find it, okay?
Yes, thank you.
But you can eat nuts, eat almond. Almond nuts have good minerals, but if you're deficient, almond nuts will not bring you to the point where you would have reached your level.
Right. When I'm not really having pains,
You want to prevent it.
I want to prevent it because I'm 71.
Wonderful, my dear. That's the best thing.
Yes.
Best thing, okay?
I'm just trying the kitchen garden.
Wonderful. You're doing the right things.
Okay, thank you. Bye-bye.
You're welcome. Bye-bye. Okay, we have room for maybe one more caller. One more. Let me see who this is. Good evening. Turn the volume of the TV down. You're the final caller. How can I help you?
Hello?
Final caller. You only have 27 seconds. Quickly.
Hi, good night, doctor.
Good night to you.
I have a problem. I've been getting constant headache,
Mhm.
and I'm not sure as to why.
What's your age?
27.
27. You're very young. What's your water intake like?
Quite a lot because I'm breastfeeding.
Okay. Are you using anything like cubes or algae in your foods?
Cubes often.
Then you bring in your headache to yourself. You're feeding yourself with chemicals that instigates or creates a headache. Cut the cubes. Cut the algae.
I don't use that, just the cubes.
Well, listen. When you use cubes, guess what you're using? Algae. Algae is monosodium glutamate. Monosodium glutamate is algae. When monosodium glutamate is added to your cube, you're eating algae.
Okay.
Okay? Take it out of your foods, drink a lot of water, remove some toxicity out of your system, and I'm quite sure if it's not your blood pressure or your blood count, your headache is going to go away.
Okay, and doctor?
I gotta go. Time is up. Sorry about that, okay?
Okay, all right.
Thank you. Thanks for participating. Bye-bye. All right, I am really sorry, but we had a late start and I was given some more time. We've got some news coming up, I think, so I've got to end the program. Thank you for participating, my friends. I hope that you learned something today, and remember, cancer prevention is better than cancer awareness. But they go hand in hand, okay? If you're not aware that cancer is out there, and that you have those cells, you should know today. What you need to do is to prevent it from being activated. Prevent those cells from becoming a reason for us to become a victim. Dr. Haynes saying good night. God bless you. So long.